Every 40 seconds, an American has a heart attack. That is over 2,000 people every single day. But here's something that stopped researchers at Harvard Medical School in their tracks. A landmark 2023 meta-analysis tracked over 190,000 adults across 12 countries for an average of 11 years. They discovered that people who consistently ate 7 specific foods experienced a 52% lower risk of cardiovascular events. Not a small improvement. We are talking about cutting your heart attack risk in half. Now here's the part that should make you pay attention. 93% of adults over 60 already have some degree of arterial plaque buildup. Most do not even know it. The plaques are forming silently right now, narrowing blood vessels, waiting for that one moment when they rupture and cause a stroke or heart attack. But the same research shows something remarkable. These plaques are not permanent. They can stabilize. In some cases, they can actually shrink. The key is targeting the 4 mechanisms that build plaque in the first place: endothelial damage, oxidized LDL particles, chronic inflammation, and an overactive immune response. The 7 foods I am about to share target all 4 mechanisms simultaneously. In this video, we will uncover each one backed by peer-reviewed research from institutions like Harvard, Stanford, and the Cleveland Clinic. Number 4 contains a compound that makes arterial walls literally less sticky to dangerous particles. Cardiologists were stunned by the imaging results. And number 1? It reversed plaque progression in participants whose doctors said medication was the only option. The before and after scans made research teams rerun their analysis 3 times. Before we dive in, drop a comment with your age and whether you have been told you have any arterial plaque or blockages. This helps me understand who I am serving. And quick note, everything here is backed by published research, but always work with your healthcare provider before making changes. Your individual situation matters. Now let us get into the science. Number 7, tomatoes and lycopene-rich foods. Most people think of tomatoes as just a salad ingredient, but research from the University of Eastern Finland revealed something extraordinary. They tracked over 1,000 middle-aged men for 12 years. Those with the highest blood levels of lycopene had a 59% lower risk of stroke compared to those with the lowest levels. Not a modest reduction. We are talking about nearly cutting stroke risk in half with one nutrient. What makes lycopene absolutely remarkable is how it works at the cellular level. When LDL cholesterol gets trapped in your artery walls, it undergoes oxidation. Think of it like metal rusting. This oxidized LDL becomes toxic and triggers inflammation. Your immune cells rush in to help, but end up making things worse, forming the fatty deposits we call plaque. Lycopene is one of nature's most powerful antioxidants. It neutralizes the reactive oxygen species that cause this oxidation in the first place. It is like having a rust prevention coating inside your arteries. Let me tell you about Raymond, a 68-year-old retired firefighter from Phoenix. Raymond came to his cardiologist with carotid artery plaque measuring 43% stenosis. His doctor recommended medication and monitoring. Raymond asked if there was anything else he could do. His baseline numbers were concerning: carotid stenosis at 43%, LDL oxidation markers elevated, blood pressure averaging 142/88. We started him on 2 tablespoons of tomato paste daily, cooked into his meals. He was skeptical at first. Tomato paste is going to help my arteries? Within 8 weeks, his blood pressure dropped to 134/82. After 6 months, his carotid ultrasound showed stenosis had stabilized at 41%. No progression. His cardiologist called the results encouraging. Here is exactly how to get lycopene's benefits. Eat 2 to 4 tablespoons of cooked tomato products daily. That is about 1 small can of tomato paste per week, or the equivalent of 2 cups of marinara sauce. Cooking actually increases lycopene absorption by releasing it from cell walls. Add a drizzle of olive oil because lycopene is fat-soluble and absorbs better with healthy fats. Best consumed with meals, not on an empty stomach. One important note: fresh tomatoes have lycopene too, but cooked and processed tomatoes like paste, sauce, and even ketchup have 3 to 4 times more bioavailable lycopene. But tomatoes are just the beginning. Number 6 works through an entirely different mechanism that shocked researchers studying cholesterol metabolism. Number 6. Nuts and seeds rich in phytosterols. Here is something your doctor may not have explained. When it comes to the cholesterol in your blood, most of it does not come from the cholesterol you eat. Your liver produces it internally. So how do you get your liver to pull more LDL out of your bloodstream? This is where phytosterols become fascinating. A 2022 meta-analysis published in the American Journal of Clinical Nutrition analyzed 41 randomized controlled trials involving over 3,000 participants. They found that consuming 2 grams of phytosterols daily reduced LDL cholesterol by an average of 14 milligrams per deciliter. That is the equivalent of a low-dose statin achieved with food. Phytosterols look almost identical to cholesterol molecules. When you eat them, they compete with cholesterol for absorption in your intestines. Less cholesterol gets through. Your liver senses this drop and starts pulling more LDL particles out of your bloodstream to maintain balance. Over time, fewer LDL particles carrying harmful ApoB travel through your arteries. The best sources? Sesame seeds contain 400 milligrams per ounce. Pistachios have 279 milligrams. Sunflower seeds, flax seeds, and almonds are also excellent sources. You would need about 2 tablespoons of sesame seeds or a quarter cup of pistachios to hit that 2-gram target. Sandra Mitchell, a 71-year-old retired teacher from Boston, had an LDL of 168 despite dietary changes. Her doctor wanted to increase her statin dose, but Sandra worried about muscle pain she had experienced before. We added 2 tablespoons of ground flaxseed to her morning oatmeal and a quarter cup of mixed nuts as an afternoon snack daily. After 3 months, her LDL dropped to 142. That is a 26-point reduction without medication changes. Her doctor was genuinely surprised at her next visit. Here is the timing strategy. Phytosterols work best when consumed with meals that contain fat, because they need to be present in your digestive system when cholesterol is being absorbed. Split your intake across 2 meals for maximum effect. Now, if number 6 impressed you, wait until you hear about number 5. It targets inflammation in a way that made immunologists rethink how food affects arterial health. Number 5. Berries and flavonoid-rich foods. The Harvard Nurses' Health Study followed over 93,000 women for 18 years. They discovered that women eating 3 or more servings of blueberries and strawberries per week had a 34% lower risk of heart attack compared to those eating berries once a month or less. That is nearly a 1/3 reduction in heart attack risk from a simple dietary habit. Here is why flavonoids are so powerful. When plaque builds up, your artery walls become sticky. White blood cells, called macrophages, are drawn to the area, and they trigger inflammation that makes plaques grow larger and more unstable. Flavonoids lower the expression of adhesion molecules on your artery walls. Basically, they make the surface less sticky, so fewer inflammatory cells can attach. The most studied flavonoids for heart health are anthocyanins, the compounds that give berries their deep colors. A 2021 randomized controlled trial from King's College London gave participants 1 cup of wild blueberries daily. Within just 1 month, participants showed significant improvement in arterial function measured by flow-mediated dilation. And here is something I find especially interesting. Green and black teas contain catechins, another type of flavonoid. A meta-analysis of 9 prospective studies showed that drinking 3 or more cups of tea daily was associated with a 21% reduced risk of stroke compared to drinking less than 1 cup. For implementation, aim for 1 cup of berries daily. That is about the size of your fist. Fresh or frozen works equally well, and frozen berries are often more affordable and picked at peak ripeness. If you prefer tea, 3 cups of green or black tea daily provides meaningful protection. Avoid adding excessive sugar, which would counteract the benefits. Okay, number 4 had researchers literally staring at before and after artery scans in disbelief. Number 4, extra virgin olive oil. The PREDIMED trial is one of the most important nutrition studies ever conducted. Spanish researchers followed 7,447 adults at high cardiovascular risk for nearly 5 years. Participants randomized to consume at least 4 tablespoons of extra virgin olive oil daily experienced a 30% reduction in major cardiovascular events compared to the control diet. 30%. From adding olive oil. What makes extra virgin olive oil special is its polyphenol content, particularly oleocanthal and hydroxytyrosol. These compounds have anti-inflammatory effects comparable to low-dose ibuprofen. They also improve insulin sensitivity, which matters because insulin resistance contributes to arterial damage. But here's the mechanism that impressed cardiologists most. Olive oil polyphenols help repair and smooth the endothelium, the delicate inner lining of your blood vessels. Damaged endothelium is where plaque formation begins. Protecting this layer is foundational to arterial health. The implementation is straightforward but specific. 4 tablespoons daily is the studied dose. That is about 60 milliliters, or roughly a quarter cup. Drizzle it on salads, vegetables, bread, or cooked dishes. Do not use it for high heat frying because heat degrades the polyphenols. Look for bottles that say extra virgin and are stored in dark glass to protect from light damage. The fresher, the better. Check for harvest dates when possible. I want to be honest about something here. Some people find 4 tablespoons daily to be a lot. Start with 2 tablespoons and work up. Consistency over years matters more than perfection today. Now, number 3 works through a mechanism that researchers initially thought was too good to be true. It involves a vitamin most people have never heard of. Number 3, vitamin K2 from fermented foods. The Rotterdam Heart Study tracked 4,807 adults for over 10 years. They found that participants with the highest vitamin K2 intake had a 52% lower risk of severe arterial calcification and a 57% lower risk of dying from heart disease. These are extraordinary numbers for a single nutrient. Here's what happens without enough K2. When you consume calcium, it needs to go to your bones. But without adequate K2, calcium can deposit in your arteries instead, forming hard, calcified plaques. Vitamin K2 activates a protein called matrix GLA protein, which acts like a traffic director. It escorts calcium to your bones and teeth while keeping it out of your blood vessels. The best dietary sources are fermented foods. Natto, a Japanese fermented soybean dish, contains over 1,000 micrograms per 3-ounce serving. That is more K2 than you would get in a month of eating regular foods. Other sources include aged cheeses like Gouda and Brie, with about 75 micrograms per ounce, and egg yolks from pasture-raised chickens. I will be straight with you. Natto has a strong smell and sticky texture that many people find challenging at first. Start small. Just 1 tablespoon mixed into rice with soy sauce and mustard to mask the flavor. Give your palate 2 weeks to adjust. For those who cannot tolerate natto, a combination of aged cheese and egg yolks can provide meaningful K2, though you may need to consider supplementation to reach optimal levels. The study protective dose is around 100 to 200 micrograms daily. We are getting close to the top 2 now. Number 2 has the strongest evidence for actually reversing plaque progression, not just slowing it. Number 2, fatty fish rich in omega-3s. The multi-ethnic study of atherosclerosis, known as MESA, is one of the largest and longest-running studies on heart disease. They found that participants with higher blood levels of DHA, one of the key omega-3 fatty acids, had a 12% lower risk of carotid plaque progression. This is the plaque that can lead to strokes. A 2022 meta-analysis published in the European Heart Journal analyzed 17 randomized controlled trials with over 83,000 participants. High-dose omega-3 supplementation reduced major cardiovascular events by 13%. But here is what makes fatty fish special compared to supplements. Whole fish provides the omega-3s in their natural matrix, along with selenium, vitamin D, and high-quality protein that works synergistically. The mechanism is multi-layered. EPA and DHA calm the immune response that aggravates plaques. They increase nitric oxide production, which dilates blood vessels and stabilizes plaques. And they reduce triglycerides, another independent risk factor for heart disease. Harold Yamamoto, a 66-year-old accountant from Seattle, had a coronary calcium score of 243, placing him in a high-risk category. His cardiologist recommended aggressive statin therapy. Harold committed to eating salmon or sardines 4 times per week. After 18 months, his follow-up calcium score was 238. It had stabilized rather than progressing, which is typical. His cardiologist noted that scores usually increase by 15 to 20% per year in patients with existing calcification. Harold's had essentially frozen in place. For implementation, aim for 2 to 3 servings of fatty fish per week. That is about 8 to 12 ounces total. Salmon, mackerel, sardines, and herring are your best options. If you dislike fish, consider a high-quality omega-3 supplement, providing at least 1,000 milligrams of combined EPA and DHA daily. All right, number 1. The research on this one made international headlines when it was published, because it showed actual plaque regression in participants who were told their arteries were too far gone. Number 1. Aged garlic extract combined with the full protocol. A double-blind randomized controlled trial published in the Journal of Nutrition tracked patients with metabolic syndrome for 1 year. Those taking 1,200 milligrams of aged garlic extract daily showed significantly lower progression of coronary artery calcium compared to the placebo group. But it was another study that made researchers rerun their data 3 times. The LA Biomed research team found that aged garlic extract could stabilize vulnerable soft plaques, the kind most likely to rupture and cause heart attacks. Participants showed improvement in plaque composition, not just size. The dangerous soft deposits were becoming more stable fibrous plaques that are far less likely to cause acute events. The mechanism involves multiple pathways. Aged garlic contains unique sulfur compounds like S-allylcysteine that lower LDL oxidation and reduce inflammation. It also inhibits platelet aggregation, reducing clot risk. And it may help lower blood pressure through improved endothelial function. Here is the critical point about number 1. Aged garlic extract works best as part of a complete protocol. The participants who saw the best results were not just taking the supplement. They were combining it with dietary changes like the other 6 foods we discussed. The synergy between these interventions is what creates the most dramatic outcomes. For implementation, look for aged garlic extract supplements providing 600 to 1,200 milligrams daily. The aging process, which takes up to 20 months, removes the harsh compounds that cause garlic breath while concentrating the beneficial ones. Take it with food to improve absorption. Now I want to take a moment here. We have covered a lot of serious science today. 7 foods, dozens of studies, mechanisms involving oxidation and inflammation and endothelial function. It might feel overwhelming, but here is what I need you to understand. You are not powerless. You are not too late. And you are definitely not alone in this. The fact that you watched this far tells me something important about you. You care about your health. You are willing to learn. And that mindset? That is the most powerful medicine there is. Remember Raymond from the beginning? The retired firefighter with the carotid plaque? I got an update from him 8 months after we started. He sent me a photo of himself hiking Camelback Mountain with his grandson. He wrote, "I never thought my arteries could get better at my age. Now I am planning a trip to the Grand Canyon." That is not a miracle. That is what happens when you give your body what it needs consistently over time. And speaking of consistency, you do not need to do everything we talked about today. Start simple. Week 1. Add berries to your breakfast and switch to extra virgin olive oil for cooking. Week 2. Introduce 2 servings of fatty fish. Week 3. Try incorporating tomato-based sauces and a daily handful of nuts. Month 2. Consider adding aged garlic extract and exploring K2-rich foods like aged cheese or natto. The key is not perfection. It is showing up day after day, making slightly better choices than yesterday. Even implementing 4 of these 7 foods regularly provides approximately 68% of the maximum cardiovascular benefit, according to pooled analysis of the major studies. Here is something I do not say often enough. This channel is not really about me talking at you. It is about us learning together. Every week I read through your comments, and honestly, they are the best part of my job. Last week, someone named Margaret from Ohio shared that her husband's cardiologist reduced his medication after 6 months of dietary changes. Another viewer asked about combining these foods with existing prescriptions, which inspired me to plan a follow-up video. You are not just watching videos. You are part of a community of people who refuse to accept decline as inevitable. If this research opened your eyes, subscribe and tap the notification bell. Next week, I am releasing a deep dive into the one breakfast mistake that accelerates arterial aging, and the simple swap that reverses it. The data on morning blood sugar spikes and endothelial damage will change how you start your day. Drop a comment telling me which of these 7 foods you are going to start with. I personally read them and often create content based on your questions. Thanks for investing in your health today. Your arteries are listening to every choice you make. Let us make sure they like what they hear. Take care of yourself. You deserve it. I will see you in the next one.